Greetings everyone. So today we'll delve into the fascinating and complex world of Loa Loa, commonly known as the African ironworm. In this presentation, we'll begin with an overview of Loa Loa, its pathogenesis and clinical manifestations, followed by an in-depth look at its life cycle and transmission. We'll then discuss the clinical diagnostic, explore current treatment options, and conclude by examining the prevention and control strategies for Loa Loa, focusing on methods to reduce transmissions, manage outbreaks, and protect at-risk populations from the parasitic infection. Loa Loa, it is a tissue nematode, which refers to a group of parasitic roundworms that reside and cause disease within the tissues of the host organisms. It causes loises, and it is transmitted by flies known as the chrysops or deer fly, and they are endemic to the Western and Central Africa and Equatorial Sudan, where this genus chrysops flies are able to find breeding spots. Moving on, Loa Loa is classified under Kingdom Animalia, phylum Nematoda, class Chromadoria, order Rhaptida, family Onchocercidae, genus Loa, and species L. Loa. Furthermore, the pathogenesis and clinical manifestations of loises results from the life cycle and migration of the worm within the human body. Now, as I've mentioned earlier, loises, it is transmitted by the bite of chrysops fly or deer fly, and this results in caliber swellings and the migration of this adult worm crosses the subconjunctiva of the eye. Now, these are some of the clinical manifestations that would be noticed. Is caliber swellings. Now, this arises from adult worms migrating through the subcutaneous tissues. Secondly is when the adult worm migrates across the subconjunctiva of the eye, and then thirdly is itchy swellings on the arms and legs, followed by when worms travels can be seen under the membrane that covers the eyes, and loises could be diagnosed by identifying the worm larvae, which is microfilary in a blood sample, or simply by seeing an adult worm traveling across the eye. Let us now look at the life cycle of loises. The infective form of loises is larvae. The diagnostic or disease causing is microfilary and adult worms, and the factor that transmit or carries the infection is chrysops fly. So basically you have a fly, the chrysops fly, that takes a blood meal. This fly is infected with Loa Loa already, so by this we could all tell that it's a parasite. When the fly bites, it creates a little wound, and the microfilary, where the larvae actually enters into the subcutaneous tissues right there. Once they get into the subcutaneous tissues, they multiply and mate, and basically as they multiply, following mating, they then develop into microfilary and eventually adult worms. The microfilary are able to be found in all sorts of tissues, such as spinal fluid, urine, sputum, peripheral blood, and the lungs. We can find them in the muscle also, and one of the places that they associated most is the eyeballs. So when an uninfected chrysops then take a blood meal from the same person, they pick up some of the microfilary, which then go ahead and develop into an infection within that chrysops fly in the salivary gland, and the cycle begins again. These are some ways in which Loa Loa or loises is identified in the laboratory. First is blood specimens, stool specimens, serum or plasma, sputum, aspirates, urine, or the whole organism. Now, some examples would be identification of an adult worm in the eye in a patient with risk factors for infections, of larvae on blood smear taken from the patient between 10 a.m. and 2 p.m. that is stained with gems or HNA to visualize the microfilary under the microscope. And also another example would be identifications of antibodies against Loa Loa. Listed here are some of the treatment that is given to patients who are diagnosed with loises or Loa Loa. The first one is TEC, diethylcarbamazine. It is an antiparasitic treatment. Most patients will achieve cure, defined as resolution of symptoms, resolution of eosinophilia, and decreasing antiviral antibody titers with one or two causes of DEC. Some will require additional causes of DEC or a trial of albendazole. The second one is corticosteroids, and the last one is albendazole or ivermectin. As we conclude with our discussion, here are some of the tips in which we can prevent ourselves or control getting the infection of loises. Firstly is by having a dose of diethylcarbamazine once a week if you would be traveling to an endemic region. Secondly is by reducing the number of deer fly and horsefly bites. Thirdly is by using insect repellents, and also by wearing clothes that is saturated with insecticide permethrin, and also by wearing long sleeve shirts and long pants. And lastly, it is good to note that because the flies, they bite during the day, having netting over beds does not aid. Brings us to the end of our discussion on loises. For more clarification, references are listed, and thank you for listening.